Research shows that over 40% of people with special needs in the U.S. have trouble getting health care when they need it.
Experts say people with developmental and intellectual disabilities are at a higher risk for a variety of health problems, from diabetes to depression. A group of Special Olympics athletes is promoting healthy living in their communities, and they're urging healthcare providers to create more inclusive environments for individuals in our state with developmental and intellectual disabilities. News Center Maine's Vivian Lee tells us more about the Special Olympics Health Messenger program.
Della Limpincati is learning how to advocate for herself when she sees the doctor.
I may not come right out and tell them right off that I have a high tolerance to pain.
Della is one of about a dozen people in Maine with developmental and intellectual disabilities who are learning to live healthier lives through the Special Olympics Health Messenger program.
And there was being rude to me.
Della and 3 other Special Olympians, Ruthie, Trent, and Brandon, spoke with first-year nursing students at the Maine College of Health Professions, sharing their experiences with getting health care.
I work with a good friend who is nonverbal. She's 24. She uses a communication device. She's in a wheelchair, and I will judge a medical professional when they walk in the room if I'm at an appointment with her, if they talk to me first or they talk to her first.
Grace Stultz, who leads health and wellness for Special Olympics Maine, says medical professionals often talk to a caregiver or guardian instead of the athlete. Sometimes behaviors that are caused by a medical issue are mistaken for their disability.
They might not express things in the same way that you or I would. It gets sidelined to, oh, it's just part of having Down syndrome, it's just part of having autism, it's part of having intellectual disability, when in reality, there's so much more medically going on with them.
Marianne Gowell, a nursing faculty member, has a grandson with autism. She says hearing from the athletes is a powerful reminder for the class that every patient has a voice.
I want the nurses to be able to do is advocate for their patients, and also be able to assess their patients and think of things a little bit differently and not associate it with their disability.
First-year nursing student Tori Wentworth has an adult son who experienced developmental delays in school.
And we need to slow things down and listen. Not be quick to say the first thing that comes out of our mouth to the person that's with them, but treat them as a human being.
Go! Special Olympics serves over 5,200 athletes across the state. The hope is to make the Health Messenger training available to anyone entering the medical field in Maine.
Because you can't select your patients. You have to treat everyone, and you have to give them quality health care.
So people of all abilities can live healthier and more independently. In Lewiston, Vivian Lee, News Center, Maine.
Special Olympics Maine also provides free health screenings for athletes and support connecting with medical providers.